Hi, Marianne here, just wanting to check back in with everybody about the live stream we did Tuesday about CBD and medical marijuana, and wanted to recap some of the highlights and takeaways for you. So there is a huge difference between hemp-derived CBD and medical marijuana. They're both from the same variety plant, the cannabis sativa, and then it breaks off into two different species. The species is cannabis sativa. It goes into two different varieties. So the one variety is marijuana. That is the one that you need to go see a physician that has the ability to certify you to go to a dispensary. The thing about that, the most important takeaway from Dr. Lipton and I, is that you need to go on to the .gov website, and you need to read those lists of conditions and make sure that you have one and that you have medical records confirming the presence of one of the serious diseases in order to qualify for medical marijuana. The second big takeaway is that the other species of the plant, the agricultural industrial hemp, has no psychoactive THC in it. At harvest, it's 0.3%, and that is the source of the CBD. Now, we also have another type of CBD called an isolate that is just CBD. It has no other constituents in it at all. I have laboratory analysis that I insist on getting, showing me exactly what's in it. And you really need to understand the quality and the source of your CBD. There is a ton of stuff out there on the internet. It's kind of become like the wild, wild west. It's important that your CBD product be fully traceable from seed to product. It's important that it has been independently screened for contaminants and that there's been a quantitative lab analysis of it. The other big takeaway is that CBD needs to be done low and slow and consistently. You need to, because it's fat soluble, the tissues in your body are going to gradually absorb it, and your autonomic nervous system and your HPA axis is going to start to adjust and balance, so it needs to be taken slowly and consistently. In addition to that, you can use it in an acute situation. So you have your schedule that we discussed at the Q&A, and you also have the ability in an emergency situation to take an acute dose. If you have any more questions, feel free to post them. I'll be looking. Thanks. Whatever you're doing, make it great.